This is Dr. Andrew Jones. In this edition of Veterinary Secrets, I'm going to show you when it's okay to treat your pet at home and when you should be seeking veterinary care. Hello you guys, and a big welcome to those of you who are new to my channel. One of the more common questions I get, is, and you may or may not be surprised, but I do get a lot of questions, is, Doc, should I take my dog or cat to the vet, or can I do this at home? And obviously this whole channel, in part, is about natural home remedies and you being much more involved as a pet owner in terms of, taking care of your pet, preventing diseases in the first place, and then using some of these home remedies as opposed to seeing your veterinarian. So my first big point is if you're not sure, you're not comfortable, by all means see your veterinarian. If your dog or cat is exhibiting any unusual symptom, you're not comfortable with it, phone your veterinary clinic, make an appointment, see your veterinarian. My second big point in terms of using these varying home remedies that I'm discussing is that it takes time. Obviously it took me 4 years of undergrad, another 4 years of veterinary school, plus on-the-job training to become a veterinarian, to become skilled at examining, diagnosing, treating clients' dogs and cats. Something that doesn't happen overnight. Likewise with you as a pet owner who's wanting to be more involved, don't expect that you watch one video on a cat abscess and bang, you can assess immediately whether or not you should be treating your cat or not. It takes time to develop those skills and get that confidence. But that being said, it is a skill that I'm quite confident that you as a pet owner can acquire. So what are some of the more serious clinical signs to be aware of? To begin with, the pet that's lethargic, very weak and tired. An example, such as my dog Lewis here, where he's really reluctant to move. He can hardly, walk around. He has no energy getting up. Clearly there's something much bigger going on in them, whether it's organ dysfunction, something relating to diabetes, perhaps they're anemic. There's obviously something else bigger going on. That warrants an immediate veterinary visit. Anemia, anytime we've got a dog or cat that's severely anemic. And in terms of getting a sense of anemia, all you may see is just your dog just really reluctant to move, very tired after a run or walk, not even willing to run or walk. They might even be breathing heavier. And one of the ways you're going to examine your dog or your cat is lifting up their lips, looking at their gums. That's just I'm doing it, Lewis, here. And you're going to look at the color of their gums. They should be sort of a nicey, healthy light pink. And they should have what's called a healthy CRT, a capillary refill time. I think you guys can see here. So I'm just pointing right here, lifting his lips, and you can see the nice pink in between the black part of his mouth. You can see where his gums are the healthy pink color. And the cap refill means where I put my finger right here on that pink part. And within less than 1 second, the color returns. That means he's got more than adequate blood pressure. Breathing distress. So if your dog or cat has difficulty breathing, these deep labored breaths, you see them almost look like they're gasping for air. Their chest might just really distend out and come back in. Obviously that's a clinical sign that warrants an immediate veterinary visit. I want to do a quick remark though, as an example of something that's less serious. It's fairly warm in the room where I'm doing this video here today. It's actually over 30-something degrees Celsius outside here in Nelson, which is somewhere in the 80s, I think, in Fahrenheit. But regardless, so Lewis is breathing slightly faster. If you look at his chest wall, it's just going up and down. That's one of the ways he keeps himself cool. So that's normal. That doesn't warrant an immediate veterinary visit. Some other clinical signs, ongoing vomiting and diarrhea. Can your dog throw up occasionally? Can your cat have the occasional bout of diarrhea? Of course. Does that warrant an immediate visit? No. But if we're looking at a dog throwing up every 15 minutes, for instance, and that's not stopping, that means there's something much bigger going on. They've got an obvious obstruction in their stomach, or something more serious such as bloat, where the stomach is dilated with air and then twisted, and causing them to repeatedly retch. Or frequent diarrhea, not just, once or twice a day. We're looking at them and them having diarrhea, every 50 minutes, every hour. Such as in the case of parvovirus or parvoviral diarrhea, and you get this severe bloody diarrhea in a short period of time. One, your dog feels extremely lethargic. Fairly soon, they get clinically dehydrated, and they need to be rehydrated. They need to have their electrolytes restored to normal for them to, at the very least, fight that viral infection. So that means an immediate veterinary visit. As far as assessing dehydration, if a dog or cat is clinically dehydrated, we're looking at more than 5% dehydration. They've been vomiting, they've had diarrhea, they're not drinking, especially, or eating, and they've gotten clinically dehydrated, then they need to see a veterinarian. You need to get a diagnosis of what's going on, and secondarily, they need to be treated as far as being rehydrated. But as far as assessing dehydration, I wanted to show you that here so you get a sense to know, is my dog or cat dehydrated or not? A couple big, simple things you can look at. First of all, just visually looking at your dog. Does their skin feel full? If you look at their eyes, are their eyes sort of sitting, look at Lewis here. You can just see how his eyes are just sitting sort of full in his globe. In a dehydrated dog or cat, they'll almost be recessed back into the globe. Because they're losing fluid within that tissue. If you lift up their lips, feel their gums, are they sort of moist? Lewis's are quite moist. He's adequately hydrated. In a dehydrated dog or cat, the gums are quite tacky. Because once again, they're losing that fluid. They don't have enough fluid to maintain the fluid to their cells. And the last big test I'll often do, it's called the skin tent. And I'll just try to show you here on Lewis. Or Lewis. Go you. And what you're doing here is I'm just grabbing a fold of skin in the back of his neck, twisting it, and I'd expect that to return to normal in 1 to 2 seconds. As it pretty much says here, instantly within Lewis, he's adequately hydrated. In a dog or cat that's dehydrated, that's going to take 3, 4, 5 seconds to return to normal. Some additional clinical signs, if your dog or cat is in obvious pain or distress, where they're hunched over, or they're yelping as soon as they try to get up. They've got a leg hiked up. You touch them in any way and they start yelping, vocalizing. Get them examined, determine what the underlying cause is. Not eating and not drinking. A couple big points I need to add here. Yes, your dog can go a day without eating comfortably. You shouldn't go much more than 4 to 6 hours without drinking. But you can go up to 24 hours without eating, and that doesn't warrant an emergency. For cats, it's much different. We don't want to see a cat, I personally don't want to see a cat go any more than 12 hours without eating, and definitely no more than 24 hours. Cats are much more prone to a condition called fatty liver or hepatic lipidosis. And specifically, that can be brought on by a cat that is ill for whatever reason. Maybe they've got a fever, they're not eating for a period of time. Then their body mobilizes all this body fat, it infiltrates the liver, then they get secondary ill with this condition called fatty liver or hepatic lipidosis. If you have a dog or cat that's not drinking, they've gone more than 12 hours without drinking at all, or they're refusing to drink, then either one, you need to be able to provide fluids with them, so being able to give something like sub-Q fluids at home. I have another video on my YouTube channel showing you how to do that, or seeing your veterinarian and have them assessing your dog or cat, determining what the underlying cause is, and then treating them appropriately. If you've got a dog or cat that is straining to urinate, I'm especially thinking of these male cats, and you look at him outside and he's straining and straining, trying to pass something in the litter box, nothing is coming out. Get your cat examined as soon as possible. The number one priority is these male cats. They're the ones that are most likely to have complete obstructions, and they do need to be seen and treated as soon as possible. And that isn't something you want to play around with and wait at home. If you've got a female cat with a history of feline urinary tract disease, FLUTD, and you actually may see her straining a little bit but passing small amounts of urine, that's much more likely that she's got this FLUTD, and she is then potentially more amenable to some of the home remedies as opposed to having an immediate veterinary visit. Animals that have seizures, it could be from something such as compost toxicity, where they've got into a compost toxin. and their whole body's trembling and shaking, that warrants a veterinary visit. Maybe something bigger, such as epilepsy. A couple more clinical signs I want to discuss. A quick note is why I'm sitting on the couch here and I'm without the stethoscope. I just realized that when you have a stethoscope hanging around your neck and it dangles into the little microphone, you get this irritating clacking noise that makes it really hard to listen to and watch. Hence, I'm redoing part of this section here. Plus, Lewis is more comfortable here on the couch. So the first thing I wanted to discuss was bloat, specifically bloat in dogs. We don't see it in cats. Just for you to be aware of the clinical signs of bloat and just knowing that it's an immediate emergency. You need to get your dog to the veterinarian as soon as possible. So bloat itself means you've got dilation within the stomach itself. So this is Lewis's stomach cavity, his abdominal wall. Stomach lies just in behind the rib cage here. And it first distends with air, so it starts to fill out with air, and then in many of the cases it can then twist, and that's called a torsion, and that requires an immediate veterinary visit. The clinical signs is your dog's going to act uncomfortable, be hunched. You're actually going to see the abdomen distended. Often people will hit the side of the belly, it'll feel like a balloon. That's distension or gastric dilation. And then if the stomach twists or causes a torsion, your dog will often then start to vomit. It'll immediately retch, repeatedly vomit, but nothing is coming up. And then they get the secondary clinical signs of shock, where their gums are pale, their heart rate picks up, they're especially weak, etc. All those signs, you see any of those clinical signs, especially you've got a deep-chested, large breed dog, suspect bloat and then get your dog to the veterinary clinic as soon as possible. So jaundice is defined as this yellowing in certain areas of your dog or cat's body. So often you can see yellowing around the whites of the eyes. So this white part around Lewis's eye is called a sclera. In jaundice or icterus, that would become yellowed. If you lift up Lewis's lips here, you look at your dog or cat's gums, lifting up their lips, you often would see the yellowing in here, within their gums themselves. And so what that means is they've got elevated levels of something called bilirubin. Most commonly that's caused from liver disease, so some type of underlying liver disease is causing that. If you're to see your dog or cat is jaundiced, you'll get them to the veterinary clinic, have them examined, have them determine the underlying cause of the jaundice. And then any type of emergencies, be it, from a car accident, where there is bleeding, there's a broken bone, maybe it's a dog fight wound, and your dog is bleeding from even a big laceration from the ear. Those are all obvious, I think, emergencies that all of you as involved pet owners are pretty clear on. But those are something you first want to get your dog or cat to the veterinarian, get them assessed, and then make a determination. Does this warrant more serious veterinary care, or is this something that we can do moderate care here at the clinic and then I can care for my dog or my cat at home? The last big point I think I want to make is the use of common sense in terms of if it looks like it's something serious, and draw the same parallel with yourself, it probably is. Bring your dog or cat in, don't just sort of sit on it and wait on it. Thank you guys once again for watching this edition of Veterinary Secrets of when to treat your pet at home and when to see your veterinarian. A couple things I want to suggest. First, if you've yet to do so, I encourage you to subscribe. You can do so by clicking that link in the box above. Secondly, too, if you've yet to get my book, it's Veterinary Secrets, Natural Health for Dogs and Cats. I go into much more detail in terms of examining your dog or cat at home, you assessing the clinical signs, determining, is this serious or not? How can I appropriately treat my dog or cat? Along with having, a comprehensive manual of diseases, the most common dog and cat diseases, along with, a real detailed list of all those specific remedies that I've discussed in my YouTube channel. And it makes a great complement to have my book along using those YouTube videos as well. If you yet to do so, I encourage you to get a copy of my book, and I'll put a link in the box below.